So that will comes from again World Health Organization WHO dictionaries. Okay, so and also for the adverse event we'll have the Medra dictionaries. Okay, very commonly these two we are going to use the Medra dictionary and WHO dictionaries. Just remember these things. Okay, in the future I'll tell you where you are going to use, but anyway we are not going to do anything with the dictionaries, and that everything will be the data management people will map in the data sets. We are going to get as in the variable form. Just we are going to do the one-to-one mapping. Okay, but just remember that. And then timing, when it I mean so first question, what happened, he replied or she replied, I'm getting the headache. The next question is that from when you are suffering for this. Okay, he said or she said, okay, from today morning or yesterday evening or something. They'll tell the time. Okay, how serious is this? Okay, so he said that getting headache, but how serious is this? A mild or moderate or very severe? So the severity or the seriousness of this events. Okay, and then is this serious or not? Okay, that information. What was the cause? What is the reason to get a headache? Okay, so these are the very common things to we are going to capture in the database. Okay, in the site level. So these kind of data points we're going to capture about the events. Okay, so there are some example in the adverse events. Adverse event nothing but what is said adverse event, and then clinical event. Clinical events is nothing but the anticipated adverse event or the clinical adverse event symptoms. These two can map into the CE, but we'll discuss in detail what is the clinical events in the future classes when we move to the CE domain. And then medical history. Medical history is nothing but when the subject is going to enroll in the study, we'll ask for the previous medical history. Previous medical history means, okay, in the previous something was happened to the subject. Okay, so for example, they has any surgeries, they had any diseases. Okay, for example, some people will have that a couple of years back diabetic. Some people will have the for last year um, thyroid. Some people will met with an accident 3 years back. It depends person to person. The medical history would be different. That history also going to capture. So these all are falls under events. Okay, under general observation classes we have interventions and then events. Okay, the next one is the findings. The findings is the huge domains will be available. So we have a many domains available in the finding domains. Okay, findings is nothing but like, I mean, name itself will have the findings. For example, if you go any hospital, I mean, for example, subject, I mean, one of the person is getting continuously from the 3 days fever, or what, or obviously what he going to do, he went to the hospital, doctor prescribed that, they just ask the symptoms, so he'll prescribe some of the laboratory test. So go for the like complete blood picture and then malaria and then whatever that is suspect, that all tests will be prescribed. Then the subject will go to the some diagnostic center. He will give the blood and urine samples, and then you'll get that results. And then again with that results, you're going to visit the hospital. Again, the doctor will check that results. Based on that particular result findings, he will conclude that okay, the subject is suffering from the viral fever or any particular malaria or dengue or it's a common seasonal fever, whatever it may be. Based on that, he will prescribe the medicine to the subject. So how we find that? Based on the lab reports. So those are the findings. Okay. So it means test related things, everything falls under the findings. What kind of test? Okay. Like if you go and then for example, okay, complete blood picture related, okay, CBP, WBC, RBC, and then eosinophils, basophils, okay, I mean urine analysis, pregnancy test. Okay, there are a number of tests available in the, I mean, market. So that all comes under the finding domains. There, based on the data points, we'll have the individual domains. Okay. So there, with what kind of data is we can expect? Obviously, the test with the results, right? What is the examination was done? What test was done? It's RBC, WBC, eosinophil, basophil. It's a test names. And the timing when it was done, sample collection time. The result. What is the result? Obviously, for example, it's a 1.2 million, 1.3 million. These are the counts for the RBC, let's assume. So this is the result. And then the subtype are finding about the additional information related to the intervention or event. Okay, so there is a one more sub finding. Okay, finding about events or intervention, that we'll discuss in the further. Just remember that. So here we'll have an example laboratory test results. So LB domain, we can call it as a LB. So what we discussed is the all lab tests will be falls under LB domain. ECG, everyone knows, right? ECG. So electrocardiogram, right? So ECG is the one of the finding domain. Okay, EG domain. Vital signs. What is vital signs? I mean, this is very commonly, if you go any one hospital, they will take the every subject vitals. What is vitals?
BP,
Main
blood
function.
rate, heart rate, pulse, temperature.
Main organs.
Exactly. Okay. Vitals is right. Okay. BP, BP, diabetes, systolic blood pressure, diastolic blood pressure, pulse, heart rate, temperature, height, weight, BMI, BSA, and then oxygen saturation point, SpO2. These all are the vital signs. So these tests will falls under vital signs. So based on the test and then based on the data points, it will falls under individual finding domain related. Okay, so there are the three common example for the laboratory domain: LB, ECG test like EG domain, and then vital signs VS domain. There are n number of domains too also. That detailed, I mean, which all are the classes will have the how many domains we'll discuss further. But this is the just example for now we are seeing. Okay, so in the general observation classes, interventions, events, finding. So these three things you have to remember, and then what is intervention, what is events, what is the findings, you have to remember. Okay, so is that clear for everyone? You have any question on this slide?